Welcome back to our channel. Today we're tackling a topic that's crucial for your health but often misunderstood: the role of water in maintaining kidney health. Did you know that consuming water the wrong way can potentially cause damage to your kidneys? Yes, something as simple as drinking water, when done incorrectly, can have serious consequences. When we talk about consuming water wrongly, we mean that both excessive and insufficient water intake can harm your kidneys. So, how do you find the right balance? What is the correct amount of water to drink, and how do you ensure that your hydration habits are actually benefiting your health? In this video, we're going to explore all these questions in depth. We'll debunk some common myths, explain the science behind hydration, and provide practical tips to help you maintain optimal kidney health. Stick around to the end of the video to get the complete picture. 1. Debunking the 8-glass myth: understanding water and fluid intake. Let's start by addressing one of the most common misconceptions out there: the idea that you need to drink 8 glasses of water a day to stay hydrated. This recommendation has been around for decades, but it's not entirely accurate. The key point to understand is the difference between water intake and fluid intake. Water intake refers specifically to the act of drinking water. Fluid intake, on the other hand, includes all the liquids you consume, such as tea, coffee, juice, and even the water content in the foods you eat. For most people, fluid intake is more important than just focusing on water alone. Your body is designed to get water from various sources, not just from drinking. So while drinking 8 glasses of water a day might be a good guideline, it's not a one-size-fits-all solution. Some people might need more, others might need less, depending on various factors like diet, climate, and activity level. 2. The dangers of overhydration: how drinking too much water can harm your kidneys. Now that we've clarified the difference between water and fluid intake, let's dive into the risks associated with drinking too much water. Yes, overhydration is a real and potentially dangerous condition, even though it's less common than dehydration. When you drink too much water, especially over a short period, you can dilute the sodium levels in your blood, leading to a condition known as hyponatremia. Sodium is a crucial electrolyte that helps maintain the balance of fluids in and out of your cells. When sodium levels drop too low, water begins to enter your cells to restore balance, causing them to swell. This can be particularly dangerous when it happens to brain cells, leading to a potentially life-threatening condition called cerebral edema. Let's consider an example from real life. During the 2002 Boston Marathon, over 500 runners participated in a study exploring race-related causes of hyponatremia. The findings were alarming. More than 60 runners were found to have dangerously low sodium levels due to overhydration. This highlights the importance of not just drinking water, but drinking the right amount for your body's needs. Another study published in 2021 reviewed 590 cases of hyponatremia related to water toxicity. The results were sobering. Patients who drank an average of 8 liters of fluid daily experienced severe symptoms, including seizures, coma, and in some cases, even death. This is a stark reminder that while staying hydrated is crucial, it's equally important to avoid overhydration. 3. The risks of dehydration: how too little water affects your kidneys. On the flip side, dehydration is perhaps a more common and well-known risk, but it's no less dangerous. Dehydration occurs when your body loses more water than it takes in, leading to a deficiency in the fluids needed to carry out normal bodily functions. Water loss happens naturally throughout the day as you breathe, sweat, and urinate. However, certain situations can increase your water needs, such as engaging in physical activity, being in hot weather, or even during illness when you have a fever or are vomiting. For those with existing health conditions, such as diabetes or kidney disease, the risk of dehydration can be even greater. When your body is dehydrated, it has to work harder to maintain balance, which can put additional strain on your kidneys. In severe cases, dehydration can lead to acute kidney injury, AKI, which can develop in as little as 2 days if not addressed. To illustrate this, let's look at a 2021 study published in Clinical and Experimental Nephrology. The researchers evaluated the water consumption of over 50,000 Koreans and found that increasing water intake was beneficial for reducing kidney impairment, especially in older men. This study underscores the importance of staying adequately hydrated, particularly as we age. 4. How your body manages dehydration, the role of hormones and the kidneys. When dehydration sets in, your body has a sophisticated system for managing it. Special sensors in your brain, called osmoreceptors, detect changes in the blood's fluid and electrolyte balance. In response, your brain signals the release of hormones that instruct your kidneys to conserve water. One such hormone is antidiuretic hormone, ADH, which tells your kidneys to reabsorb water rather than excreting it in urine. Another key player is the hormone renin, which is released when your blood pressure drops. Renin triggers a cascade of reactions that ultimately help restore your fluid balance and blood pressure. While these mechanisms are effective in the short term, prolonged dehydration can overwhelm them, leading to chronic kidney damage. This is why it's so important to respond to your body's thirst signals and to drink water regularly throughout the day, especially during times of increased fluid loss. 5. Practical tips for monitoring your water intake. So, how can you ensure that you're drinking the right amount of water for your kidneys? Here are some practical tips. Pay attention to thirst. Your body's natural thirst mechanism is a reliable indicator of when you need to drink water. Don't wait until you're extremely thirsty, as this could be a sign that you're already mildly dehydrated. Monitor your urine. The color, odor, and frequency of your urine can give you valuable clues about your hydration status. Clear or light-colored urine usually means you're well hydrated, while dark yellow or amber urine indicates dehydration. Consider your environment. If you're in a hot climate or engaging in vigorous exercise, you'll need to drink more water to compensate for the increased fluid loss. Balance your electrolytes. If you're sweating heavily or losing fluids due to illness, consider drinking an electrolyte-rich beverage to help maintain the balance of fluids and minerals in your body. However, be cautious with these drinks if you have kidney or heart issues, as they can contain high levels of sodium and sugar. 6. The role of electrolytes in hydration, when and how to use them. Electrolytes are essential minerals that carry an electrical charge and help regulate various bodily functions, including fluid balance, muscle contractions, and nerve signaling. Common electrolytes include sodium, potassium, calcium, and magnesium. While most people can maintain their electrolyte balance through a normal diet and regular water intake, there are situations where you might need an extra boost. For example, during intense physical activity or when you're recovering from an illness that causes fluid loss, an electrolyte drink can help replenish what's been lost. However, it's important to choose these drinks wisely. Many commercial electrolyte drinks contain high levels of sugar, artificial sweeteners, and preservatives, which can be harmful to your kidneys and overall health. Whenever possible, opt for natural sources of electrolytes, such as coconut water, citrus fruits, leafy greens, and nuts. 7. Addressing common myths about hydration and kidney health. Before we wrap up, let's address some common myths about hydration that might be affecting your kidney health. Myth 1. You must drink 8 glasses of water daily. As we discussed earlier, this guideline doesn't apply to everyone. Your water needs depend on your body size, activity level, and environment. Myth 2. The more water the better. Overhydration can be just as dangerous as dehydration. It's all about finding the right balance. Myth 3. Drinking water is the only way to stay hydrated. Remember, your fluid intake includes all beverages and water-rich foods, not just plain water. Myth 4. Electrolyte drinks are essential during exercise. While they can be helpful in certain situations, they're not always necessary and can sometimes do more harm than good. Myth 5. Caffeine and alcohol are always dehydrating. While both can increase urine production, moderate consumption of caffeine and alcohol can still contribute to your overall fluid intake. Just be mindful of their effects on your kidneys. 8. Special considerations for those with kidney issues. For individuals with existing kidney conditions, such as chronic kidney disease, CKD, the advice on water intake can be more complex. As kidney function declines, the ability to regulate fluid balance is compromised. In some cases, doctors may recommend restricting fluid intake to prevent overloading the kidneys. On the other hand, for those prone to kidney stones or urinary tract infections, UTIs, increasing water intake is often recommended to help flush out the kidneys and reduce the risk of stone formation or infection. Always consult with your healthcare provider to determine the best hydration strategy for your specific needs. 9. The truth about bottled water versus tap water. One of the questions we often get is whether bottled water is better for kidney health than tap water. The answer depends on various factors, including the quality of your local tap water and the type of bottled water you're consuming. In many parts of the world, tap water is perfectly safe and meets strict quality standards. However, in some areas, tap water may contain contaminants or minerals that could pose a risk to your health. Bottled water, on the other hand, is often marketed as a safer alternative, but it can vary widely in quality depending on the source and how it's stored. When choosing water, the most important thing is to ensure it's from a safe and reliable source. Whether it's tap or bottled, the water you drink should be clean and free from harmful substances. 10. Final tips for maintaining optimal hydration. As we wrap up, here are some final tips to help you stay properly hydrated and protect your kidneys. Drink water throughout the day. Don't wait until you're thirsty. Make it a habit to sip water regularly. Eat water-rich foods. Incorporate fruits and vegetables with high water content, such as cucumbers, watermelon, and oranges, into your diet. Be mindful of caffeine and alcohol. While moderate amounts are generally safe, excessive consumption can strain your kidneys. Stay informed. Pay attention to your body's signals and adjust your water intake based on your individual needs. Conclusion. We've covered a lot of ground today, from debunking common hydration myths to understanding the critical role of water in kidney health. Remember, adequate hydration is about more than just drinking water. It's about maintaining a balanced fluid intake that supports your body's unique needs. Thank you for tuning in and supporting our channel. If you found this information valuable, be sure to hit the like button and subscribe for more health insights. And don't forget to click on the video on your screen for even more tips on how to protect your kidneys and improve your overall health. Stay educated, stay healthy, and we'll see you in the next video.